Welcome to Women of the World, a show which gives a voice to women from around the world who have chosen to make the United States their home. Here's today's moderator, Nadia Jordana.
Hello and welcome to Women of the World. I'm Nadia Jordana. Our guest today is Rosa Tock. She is the Executive Director of the Minnesota Council on Latino Affairs. Originally from Guatemala, she came to Minnesota as a Fulbright scholar. We're very excited to have her on the show today. But first, let me introduce my co-hosts. Beverly Crosby, welcome to the show.
Thank you, Nadia. I'm really looking forward to talking to Rosa and learning so much about her background and what she's doing. Sounds like she's a very active person in our community. We're lucky to have her.
And Amalia Moreno-Damgaard, I'm glad you could be here today.
Thank you, Nadia. Me too. It's always a pleasure to be here.
Rosa, you're our guest, and I'm so happy to see you. Why don't we kick off the discussion by hearing about your work on the council?
Yes, sure. Well, it's great to be here with all of you this afternoon. Thanks for the invitation. So our council is a state agency that advises state government, the office of the governor and the lieutenant governor, and particularly the legislature on issues that are important for our Latino communities across the state. So the council is composed of 15 council members. They represent different congressional districts. And there's also 4 legislators from each party and in each chamber, which makes us a non-partisan agency. So when we go there to the state capitol, or when we discuss policy and legislation with legislators or with state agencies and policymakers, we do that with neutrality and based on facts and evidence, and we provide to all of them the same kind of information so that they learn more about the community. They can make decisions based also on what community members share with us in terms of the priorities, but also in terms of the recommendations and solutions that they might see in different areas of our work. We focus primarily on education, so solutions around how to close the opportunity gaps, the achievement gaps, on economic development and taxes, and also a little bit around health and well-being. And at the same time, we try to incorporate different immigrant experiences of our community, because although almost 2/3 of Latino Minnesotans are born in the US, there's about 35% who are immigrants. And although immigration policies set at the federal level, as we know, it still has implications locally and statewide. So we are always including also the experiences of diverse generations of immigrants in the state.
Amalia, did you have a question?
I do. Thank you for being here, Rosa. It's fascinating to hear the work that you do. It's a very important work for our community, for our state. And I follow you on social media, so I'm familiar with some of the work that you have been doing lately. I am interested in hearing more about how our community in general, but also our business community on the Latino side, has been impacted by COVID in this last 6 months.
Yes, definitely. I think that the pandemic hit all of us without being prepared and well informed. And I think that as we saw for many communities in the state, I think that the lack of information at the very beginning and the lack of understanding of what the pandemic was about and what the preventive measures, how important they were, I think that it had a very disparate and unequal effect in Latino communities. Primarily because the main sectors where Latino Minnesotans work are in factories, in meat packing plants, in canneries, and in the hospitality services and janitors and healthcare sectors. And those were places where there were a focus of the pandemic. And so that made our community feel the impacts of the pandemic in very disparate ways compared to other communities, along with African Americans and indigenous. So because of the kind of work that our community does, that's how they were more exposed, if you want, to the virus. The other factors behind that is the kinds of housing or the kinds of the kinds of housing where they usually live. The fact that, as you know, Amalia, we like to be in community, we like to be with family, we like to share, and we like to be all together. And that has put a lot of strain and stress also in many families because you can't do that anymore. But sometimes it took a little while for everybody to understand what were the main preventive measures that we would all follow. And I think that there was also this lack of bilingual information for many in the community as well, which proves how important when there is a public health problem, how important it is to have bilingual and culturally competent information, because the fact that the way that many of us received information is not the same way that other people, particularly people working in the fields or working in these industries or in the community, who many times are isolated, need the information. So those are some of the factors behind how the pandemic affected our communities.
When you talk about how it's affected the community, Rosa, one of the questions I have is about Women Venture. I know that's one of the organizations that you're very involved in. And what do you tell the women who are trying to start a new business? How do you encourage them with the pandemic going on as it is? What would you say to them?
Yes, so I've been very lucky and honored to be part of the board of Women Venture, and at the same time was able to witness the hard work of the team, the staff there, and the executive director and the team, who were immediately ready to support the existing clients with whatever guidance and whatever support they needed to keep afloat during this crisis. And so what Women Venture has been very supportive is in providing whatever kind of guidance and training and being there for them. So one thing that I would suggest is for those women who are still interested in exploring business opportunities to contact Women Venture, to talk with staff, because they would be very well prepared to support them in any questions that they would have as a nonprofit who is there to support them in their ventures, in their business ventures. I think that despite the crisis, I think that Women Venture is very well positioned and in a good health and financial situation to also provide whatever guidance is needed.
You know, Rosa, I was especially paying attention when you spoke a moment ago and talked about bilingual information. That's something I hadn't given a lot of thought to, but I can see how important it would be. And I guess my question is, I'd like to hear more about your work in public health and racial equality.
Yes, so I think that this pandemic, this COVID-19, really brought to our attention, or maybe to gave more visibility to what many studies and many people in different diverse communities, multicultural and multilingual communities, have been talking about. And this is that when you have a crisis of this dimension and is impacting everyone, I mean, there's no, this pandemic is showing us that it doesn't discriminate on the basis of language, national origin, where you come from. And the more everybody's informed about it, the best it is, because that way we won't all be exposed and suffering the repercussions and effects of the pandemic. So health equity, or health equity, if you want, is how we remove barriers of access to things like healthcare insurance, healthy foods, healthy lifestyle, and other preventive health measures that might reduce, for instance, in the Latino community and other communities, for instance, that prevalence of diabetes or chronic disease like heart failure, or and others that might be factors that might make worsen the if you get COVID. So removing those language barriers for many in the community is important, and that is why I think that the state of Minnesota has gradually been making more efforts to bring that information in many languages, including Spanish or Hmong or Somali, Karen, and others, because as I was mentioning, even though for our community, most people would speak English very well, or would be bilingual, or speak English only, there's still approximately 25% of them whose English is less than well. So these are the communities that need that we reduce that access. That to reduce the barriers to access the best information, so that they can be well prepared for not only this current moment, this crisis, but apparently it's going to continue. So I think that it's important.
Rosa, you mentioned that your family is very social and gathering together is very important. With the pandemic, of course, we know that we've had to limit that contact. How has your family adjusted to that? What changes do you see being made, not just with your family, but people in your community?
Well, there's been a variation, I would say. It's very different depending on the families and depending on the communities, I would say. In my case, for instance, all of my family lives in Guatemala City, in Guatemala, and they have been very, very, very strict. And they have been completely isolated from pretty much from the world, you know. And so they have taken turns. The young ones, they have taken turns to go to the grocery stores or to do the little chores here and there. But in the case of my parents and my relatives who are in the risk age, they've been kept in complete confinement for the last 6 months. So that's in the case of my family, and also in the case of others that I know. But there are situations where that is almost practically impossible. As I was explaining, there are families who, because of their needs, are living in crowded buildings or apartments or houses. And this is a little bit more difficult, or they don't have the luxury of working from home, like many of us do, and they have to go to still to the plants and to these factories, and they still need to provide for their families, and so it's a little bit more difficult to keep the social or the physical distance. So that's when it's important to have these strategic partnerships, if you want, between government, between the counties, between the municipalities and the employers, so that they have a good understanding and they provide enough protections for the workers. Because again, the pandemic is not discriminating on the basis of what kind of work you do. So the more everyone is protected and has these protections, the best it is in the interest of all communities. So I think that there's more and more a consciousness about the importance of wearing a mask, for instance, the physical distance, and making sure to have all the sanitizing products handy, so that you can keep that those barriers to the pandemic. So what we need to do is put more barriers to the virus, to the spread of the virus, but reduce barriers to healthcare for everyone.
I am curious, Rosa, you talked about the need to translate materials and information to reach the various communities. And I certainly have seen a tremendous change as a result of COVID. Just about everything has gone virtual. So there's been organizations that historically have not published anything bilingual, even though they serve a Latino community, switch completely to become more active and to become more responsive so that they can reach the communities that need it the most. So the government is doing this as well, as you mentioned. So I am wondering how you measure the impact, and how do you know that the information is reaching the populations that you're trying to reach, those that do not speak English at all, and those that are in the rural communities? How do you, is there any kind of a report, statistics? How do you measure the results of translating the information?
Yes, that's a great question. And I think that this is still work in progress. I suppose that at this point, the Minnesota Department of Health will be conducting these kinds of studies to measure the impact and the outcomes of translating that kind of information. For sure, I know that they've been doing lot of outreach with Latino organizations who are, if you want, on the trenches or in the field, working directly with communities, and they are identifying the trusted messengers in the community. This is how they've been doing their information outreach, to make sure that it goes to everyone. And so that's very important and interesting work that MDH has been doing lately. So they've been reaching out not only to those trusted leaders or community members, but also to the ethnic media, radio, TV, and making sure that they identify those who are the most, again, who have the trust, who have been in the community for a long time, and so through them, those would be their channels for information. But at this point, I don't know if they have done any kind of study to measure the impact, but definitely something that I would hope that it's not only during the pandemic, but for any kind of important information that the government wants to translate or to transmit to the population at large.
Rosa, I'm wondering, is there, in the course of your work, Is there anything that you have had plans for and still have plans for that you haven't yet been able to implement that you're really looking forward to having happen to help the community?
Yes, that's a very good question. Since everything is so complex and everything kind of is how do you say, intertwined, and we cannot see all of these areas in isolation, but in a coordinated way. I would say that it depends. This is why sometimes I like to see those problems, but also not only as problems themselves, but also as opportunities. And so how we can transform those identified gaps or problems into opportunities for the community. And it has to be done from this perspective of health in all policies, which means that we need to see that we need to make sure that communities, for instance, again, as I was mentioning, for instance, have access to good paying jobs, that they have access to a quality education in their schools, that they have also access to healthcare. 26% of Latinos in the state don't have health insurance. And so what are we going to do with a growing population? The Latino population is one of the fastest growing populations in the state. It's very young. The median age is 25 years old compared to 38 years median age for the rest of the population. So we are talking here about the future of the state and the future health of the economy of the state. So when we see all of these different factors combined, you know, it is in the end interest not only of our communities, but also in the interest of the state of Minnesota to make sure that the future generations, which will be replacing the current labor because of, you know, the baby boomers are retiring. And who is going to then do the jobs that will be left in different sectors, in healthcare, in public administration, in the STEM sector. So we need to make sure that everybody has those social determinants of health covered. Again, as I was saying, as I was referring to previously, community members who are healthy, who are well educated, who are well integrated into the social fabric of Minnesota, so that everybody can enjoy that prosperity and can support the economy of the state. And by that, I also mean the importance of women who are also the majority in our population, to be able to lead, thinking in a multi-generational frame, you know, thinking about their families, thinking about the children, and women in our communities also play a very important role, as Amalia knows that. So I think that's pretty much how I see it. So it's a more complex response to maybe the question that you were asking, but I like to see it that way, because one area cannot be isolated from the other when we talk about improving the conditions for every person in the state.
Beverly, did you have a question?
I'm surprised that the health issues, the percentage of people who do not have health insurance amongst the that particular group is so high. Why do you think that is? And what could be done about that?
Yes, that's a good question. And it has to do with the kind of jobs that an important segment of the population has. So sometimes those employers would not provide health insurance as part of the job, and sometimes it's also because some of them might lack papers, and they might not then be eligible for some of the public programs. But it has mostly to do with the kind of sector they might be employed and whether or not the employer would offer that, that benefit or those programs. And so what can be done about that? Definitely there's a lot of discussion nowadays about universal health insurance or health insurance for all or Medicare for all. So those are conversations because again, I think that the more people are covered and contribute in paying those programs, whatever the formula is, I think that in that sense also the best it is for the public health of everybody.
We're coming close to running out of time. I wanted to give you an opportunity, Rosa, in case we haven't asked you something that you would have liked us to ask. Is there something special you wanted to say before we close the program?
Not really, but I just thank you so much for this interview, for this opportunity and the chance to talk with everyone here. I don't know if you want to be involved or if you know of women interested in supporting our work or talking to our staff or offering testimonies at the legislature around issues that are important for them, particularly in the Latino community, please contact us. I think that you have my contact information on your screen and our website as well. So please be in touch with us if you want to learn more about our communities and the work that we do.
That's great. And thank you for being on the show today, Rosa, and Beverly Crosby, Amalia, Moreno-Damgaard. And thank you everyone for watching the show today. We'll see you next time on Women of the World.